Much, Mr. Chairman. I have to associate myself with Dr. Burgess's timeline here because he's absolutely right. In the late aughts, and I've been on this subcommittee for 27 years, and I have either been the chair or the ranking member a number of years. And the CDC, it has been an agency that for all those 27 years, we've been wringing our hands about how we can improve and bring into the 21st century. And Dr. Burgess is right. When we had the avian flu hearings, we thought that we had solved some of these fundamental systemic problems at the agency. We were pretty smug. But then, as he said, we had Zika in 2016. And then in 2020, first of all, let me say, December 4th, 2019, this subcommittee had a hearing. And in that hearing, we were doing a hearing about CDC and about pandemic preparedness, and we asked the experts, including Dr. Fauci, what's your worst nightmare? This was December 2019. And Dr. Fauci said his worst nightmare would have been an international pandemic. And lo, it came to be only a few months later. And the problem was the CDC as an agency still had not updated its data collection, its communications with the states, its organization to the point where it could deal with an international pandemic. Dr. Redfield was the head of the CDC at that time, and Dr. Burgess is absolutely right. The CDC could not even complete the fundamental efforts of developing a COVID test because the test samples at what is supposed to be the preeminent agency in the world were contaminated. So I think we can sit here and emote all we want and finger point about the schools and everything else, and much of that I agree with, but I think that the usefulness of this committee, Madam Chair and Mr. Chair, is if we start to think about what kinds of reforms we can really make and how we can be partners in that. So Dr. Walensky, before she saw this too, this subcommittee had a trip down to Atlanta to look at the CDC, and we met with Dr. Walensky, and she was brought in, and she saw these issues too. So before she announced her departure, she had a number of changes that she suggested in the Moving Forward initiative. And I'm just going to state what some of those initiatives are, because I think they're worth us and the CDC exploring them. Standing up new internal systems, processes, and policies to enhance bidirectional communication and accountability. Establishing clear outcomes and timeframes for deliverables and bidirectional engagement for core capabilities and agency-wide initiatives. Implement new governance structures to ensure accountability closely tied to funding decisions. Share scientific findings and data faster and better translate. Share scientific findings and data better, promote results-based partnerships, develop a workforce prepared for future emergencies. These are broad goals, but I'd like to ask the panel, do any of you disagree with these as broad goals? First, I'll ask you, Dr. Denigan McCauley, yes or no? Do you disagree with these as broad goals?
We do not disagree.
And what about you, Dr. Dean?
I do not disagree.
And what about you, Dr. Hogue?
I don't disagree.
And what about you, Dr. Benjamin?
I agree with those goals.
Thank you. I think so too. She also talks about a list of new authorities that Congress should provide. Public health and regulatory authorities, e.g. mandatory data reporting, paperwork reduction action exemptions, et cetera. I know we all love fax machines, but maybe we should look at paperwork reduction. Human resources authorities, e.g. hazard pay, overtime pay, direct hire authority, hiring authority exemption, et cetera, and other operational authorities. And then she suggests a bunch of other next steps. appointing a seasoned executive to implement the vision. And we're really hoping that President Biden's new nominee will do exactly that. And then some other things I don't have time to mention. Look, we need to fix this agency, and so let's just do it. Because the next pandemic is right around the corner, and if we don't have our public health ducks in order, if we're still sitting around bickering about should the schools have been closed or should there have been mask mandates, then we're going to really lose in the next round. And I yield back.